My name is Pamela Price. I'm an African-American woman who's lived with menopause. So my experience with menopause was really interesting because the first round was due to induced menopause when I was in my 20s. And I experienced extremely severe hot flashes, mood swings. My hair got extremely thin. I later also experienced menopause that was surgically induced this time around. It was even more severe just because it was, again, immediate. The hot flashes I experienced for months. I had migraines that I had never experienced before. There was obviously just anxiety that I also experienced. The mood swings were really bad. Those are things that I think we don't think about in our conversations around menopause, and all these things happening well before, you think you're in that stage of life. And so those are definitely things I think we should talk more about, is those other causes for menopause that we can experience, especially those of us who are a little bit younger. The cultural competency that is often missing, I, like probably many women, also just felt that was lacking. Nobody even told me, what do you do about hot flashes? I'm 20 years old, and so, there was just no kind of social, cultural history or context taking into consideration. It was just like, hey, once we're done with what we've laid out, you're going to have to figure, the rest out. I think we do not know enough about our reproductive system. We don't know about all the things that could go wrong. I would really, really just encourage older women to think about the conversations that we're having with our daughters, or to those younger women who we have access to share our stories with them, the good, the bad, and everything in between. I think for those of us who have gone through it, or those of us who are currently going through it, I think us being educated, it's clear that our healthcare system is deficient in a few things in terms of just equipping providers with what they need. So I think it's also our responsibility as well to know what's available. What are those things that you really, really should be concerned about, and how to become your best advocate and empower yourself through education, through knowledge, through awareness. And for African American communities and minority communities that silence is always the best option, I would challenge us to break that silence, that we don't have to suffer the way grandma, mom, auntie did, that it is okay to talk about it with someone. And so those would be my, my advice, to women.